You're listening to Treating Blood Cancers, the LLS podcast series for professionals. We will be joined by cancer experts to discuss blood cancer diagnosis, treatment, side effects management, and the importance of clinical trials. They will share their experience in treating patients and discuss strategies for optimal patient care. Let's get the conversation started.
Welcome to Treating Blood Cancers, the LLS podcast series for professionals. I'm Dr. Ken Miller. I'm a medical oncologist, hematologist, and an LLS volunteer. And I want to thank all of you so much for joining us on this episode. Today, we'll be discussing the critical role of caregivers and care partners, addressing the unique challenges they face and providing strategies for healthcare professionals to effectively communicate and to support them. We're delighted to be joined by Dr. Timothy Pierman, who is the Director of Supportive Oncology at the Robert H. Lurie Comprehensive Cancer Center at Northwestern University. He's also a professor in the Department of Medical Social Sciences and Psychiatry and Behavioral Sciences at the Northwestern University Feinberg School of Medicine. Tim, thanks for joining us.
Thank you so much for having me. It's good to be here.
So let's start out with a very basic question. We talked about caregivers and care partners. What does that mean in terms of a definition and how that experience starts and evolves for people that are put into that role?
I would say it's a pretty big umbrella in terms of what a cancer caregiver means. But I think broadly defined, it's anybody that provides emotional or physical or financial or any kind of support to help someone through their cancer journey. So it can be a partner, a husband, a wife, it can be any family members, or it can even be friends. And I would also add that cancer caregivers sometimes aren't even physically present in the same city as the patient themselves. So it can be kind of a long distance relationship as well.
Well said, and nice to remember, especially because things obviously can be much more digital now than ever before. I have to tell you, I met a woman who's 40. The patient in this case is an aunt who's age 70 and has advanced breast cancer. This young woman herself went through that experience with her mother, who died of breast cancer about 20 years ago. It made me think of the following that I want to just pose as a question, but how does a person's own life experiences, whether with a previous illness themselves or with a family member, how does that affect their role as a caregiver in a new situation?
Yeah, I think it has a really, really big impact. Sometimes in exactly the way that you said, if this person has a past experience, either themselves going through cancer, or if it's, in the case of breast cancer, if it's a family that has an inherited genetic predisposition for breast cancer, then there can be a lot of kind of surrounding fear and chaos and all of that. And the other thing I would say is, even if the social situation doesn't involve a past experience with cancer, you see a lot, especially in older partners, where the person may be a caregiver for an aging parent, and then all of a sudden they're a caregiver for their spouse, and they're still trying to work and do all those things. And so in those situations, the social network and the social supports can just become really complicated and really burdensome.
In your experience, in your practice, I'm interested in, your sense of how people who become caregivers, what is that experience like? How do they adapt to it? And I'm also interested in sort of what are the outcomes for them?
Yeah, and there's a growing literature about this that's actually looked at that. A lot of the literature has been in men who have been diagnosed with prostate cancer, and they're mostly female partners. And what the research has kind of shown in that limited population is that caregivers really do experience some distress. It's really hard to be a caregiver. But on the flip side, almost none of the caregivers that have been involved in those studies regret their decision to be a caregiver. So they feel that it's a really rewarding role, but it definitely takes a toll.
As providers, there's certainly a desire, at least I'll speak on my part, to keep the caregiver, the partner, that person involved. And then, there's concerns about HIPAA. So what are some ways to navigate that optimally?
I think the easiest way for providers is simply to ask, is it okay if your wife, your sister, your brother is involved in our meeting today. But I think all of us who are providers have had the experience of having a patient that you meet with their families and you ask them how they're doing, and they say, I'm doing fine. I'm doing okay with the neuropathy. I don't have any depression. I'm doing everything fine. And then you leave the room and their caregiver follows you out of the room, closes the door, and said, he's not telling you the truth. That's a lie. He's not getting out of bed during the day. He doesn't come down for meals. He doesn't want to spend time with the grandchildren. So I think that really speaks to how important it is to involve caregivers where we can, because I really do think oftentimes there are two sides to the story, and what the patient themselves may tell their oncologist may be very different from the reality on the ground, because everybody wants to be the best patient. Everybody wants to be an A+ patient. Nobody wants to be a complainer. And so there's a variety of reasons why I think people undersell their distress when they're going through cancer treatment.
All right, it's really a real life situation that we have all been in. So I'm sitting talking to a patient. The way the room is configured, the family member is behind. And I ask that question. I say, how are you doing? And the patient says, oh, I'm doing very well, doctor. And literally the family member in the back is shaking their head saying,
Yes.
all right. So what do you suggest, Tim? How do, as care providers, oncologists, what are some ways to deal in the room at that moment?
Yeah. And first of all, I would say, if you have social workers, psychologists on site, definitely utilize them, because I think that's a lot easier than trying to kind of investigate the family dynamics when you are an oncologist and you have literally 5 or 10 minutes with this patient. You just don't have the time to do it. So I think it can be really helpful to sort of, as an oncologist, to normalize that, hey, disagreements among family members about how you're doing with cancer treatment are very normal. And sometimes it can be really helpful to talk about that with a trained professional. So I would say definitely use the resources that are available to you if you have them. The other thing I would say is there are great support resources for both caregivers and patients. So there are a wide variety of support groups for both. And I think what you see sometimes in families is that neither the patient nor the caregiver wants to be a burden. And so they won't say if they're struggling, if they're feeling depressed, if they're scared a lot of the time. They just don't want to burden the other person. And so what ends up happening is you have these two people that care a great deal about each other, but they end up sort of going to their own separate corners and sort of dealing with their grief or their distress in their own ways. So I really encourage families as much as possible to just say whatever is on your mind. It's not going to be a burden. It's actually really helpful and can kind of normalize the distress that the other person may be feeling.
Yeah, and actually, by the way, thank you. That's well said, and at least resonates with me for times that I personally, we all are one day or another a patient, and we're also all one day or another a caregiver. So thank you. Let me ask you, just from your experience, your practice, what are some examples of what clients, people have come to you for who are caregivers?
Yeah, that's a really good question. I just met yesterday with a couple who came in, and it was the first time I'd seen them. And basically, the wife was the caregiver, the husband was the patient. And we spent almost the entire session talking about the stress that the wife was undergoing. And the husband was a 3-time cancer survivor, had a stroke, but he actually seemed to be doing fairly well with those challenges. But the wife felt as though she had the weight of the world on her shoulders. She had to worry about all of the finances. They had to move back from their retirement in Mexico to seek medical care in Chicago. They had a lot of financial struggles because they had a son who was in a motorcycle accident and basically hung on needing constant care for about 10 years, completely draining their financial resources before he passed away. And she felt like all of this was on her shoulders. So again, you see those situations where you start with the cancer piece, but the actuality of the situation is so much larger.
Yes, I mean, it definitely sounds that way. And how can you as a therapist be of help in that situation?
Yeah, and I think in their case, it was kind of drawing out the husband who seemed kind of in his own shell to say, what are you feeling and how do you get your needs met and how do you help your wife? Is there a way that you could help more? Or do you feel like she's sort of guilting you in a sense. The other thing I will say is that I think a lot of caretakers try to give this message of positivity, that you've got to stay positive, you're a survivor, you're going to beat this. And I've definitely seen that have sort of the reverse impact on patients themselves. One of my mentors, Jimmy Holland, who was at Memorial Sloan Kettering for years and years, you probably know her as well, but she wrote an article at one point that was called The Tyranny of Positive Thinking. And that title has always stuck with me because I think it's so telling. And her point was, it's not realistic to be diagnosed with a life threatening disease and be positive all the time. That would be a crazy response. And so she felt like even though that feedback was well intentioned, that you've got to stay positive, you're a survivor, you've got this, it led to people feeling, quite frankly, guilty that, why am I not coping better with this? I don't feel positive all the time. I'm scared and I'm anxious and I feel really down sometimes. And what is wrong with me that I'm not handling this better, because I should be positive? And in addition to that, people felt like, am I actually contributing to my cancer coming back or progressing because I'm not positive? And her point in this article was that there's no research at all to suggest that people who don't think positive are more likely to have progressive cancer or to pass away from their disease or any of that. And so she felt like it was important to put out there that it's okay to not be positive. And I've never seen someone diagnosed with cancer that was always positive.
So, along those lines, normal relationships, at least in my experience, I mean, there is conflict also. There's, short term, long term relationships. What happens to those kind of just the day to day in the midst of a major illness and caregiving? Where do those feelings go?
Yes, it's really complicated. I will happily share this. I'm a cancer survivor myself. I'm 55 now, and I was diagnosed with stage 3 head and neck cancer when I was 36. And I was in New Orleans at the time. My mother, who I love dearly, was in Florida, and she drove me absolutely crazy. Again, very well intentioned, but she would call me at least once a day, sometimes multiple times a day, be in tears throughout our call. And again, say things are going to be fine. Things are going to be fine. And it got to me to the point where I felt like I was just getting mean and saying, it's probably not going to be fine. This is an advanced head and neck cancer and it's likely to come back, which wasn't helpful for her. It made me feel bad. So I think, some of that tension that was completely surrounding cancer really did change our relationship for that brief moment in time where I felt like we had such a wonderful relationship before that, and I would dread seeing her call. So I think, to your point, cancer really can at least temporarily change the tone and context of a relationship. And I think it's really important to note that when you see it between couples, when you see that tension, and to encourage them to do something about that, to get help on their own or to seek couples therapy or family therapy and really address those issues.
So let me share, since we're sharing personal experiences, I think as some of the listeners have heard, my wife had leukemia 25 years ago and was profoundly disabled physically and emotionally afterwards. What I noticed was relationships have their own rhythms to them, sort of sharing responsibilities. When Joan was as sick as she was, she really could not do any of those, including parenting was very, very difficult. When she got better, I think pretty naturally wanted and expected those responsibilities back. I found that to be a very difficult time, the readjustment, the renegotiating. What have you observed?
That's so interesting. And that makes perfect sense. Yeah, I've definitely seen that as well. That once cancer is a little bit in the rearview mirror, it is almost a renegotiation of those relationships. Like, okay, now we're in a different place. What does our relationship look like? I think that's really true and very telling.
Yeah. So, another expression, it's not over when it's over. That I think a caution we can give people going through this, couples or partners going through it, is that it's a process, I guess, and that whatever their experience is, it's one that may evolve over time.
Yes. And I think to that point, having cancer rear its ugly head in a relationship can go either way, it can really highlight some of the deficiencies in the relationship that maybe were being swept under the rug. I've definitely seen couples that have decided after cancer treatment that they didn't really want to be together anymore and that they were okay with that. But on the other hand, there's that concept of post traumatic growth that I think caregivers can experience as well, where they feel like, now that cancer is in the rear view, I really want to focus more on this relationship. And I was focusing way too much on my work or on time spent with friends and not time working on this relationship. And so I think a lot of people can really use cancer as a positive. So they're able to find that silver lining in that really dark cloud.
How can healthcare providers involve the caregiver in supporting the patient?
Yeah, I think the biggest thing that healthcare providers can do is normalize the role of the caregiver, that it is so important to have someone with you at appointments, even if simply for having two sets of ears to listen to medical information. Because, I mean, again, I'm sure everyone on this call has had the experience of just seeing the blank face after someone gets a diagnosis of cancer and they're not hearing anything that you're telling them after that. And so I think in any medical appointment where treatment is being discussed, it really helps to have somebody present. And I think as a healthcare provider, just to normalize that can make that easier for patients because, again, nobody wants to be a burden. And so I think a lot of times people kind of try to be the hero and say, "No, I'll be fine. I'm fine on my own. You don't need to come with me. I can get myself to my appointment and get myself home, and everything's fine." So I think just normalizing it is probably the biggest thing we can do to help people.
Along those lines, what are the signs of burnout? And how can people at the bedside in the office, how can we, the direct providers in the cancer care arena, how can we recognize burnout and what can we do about it?
Yes, yeah, because sometimes it's obvious. Sometimes the caregivers will be right up front with, "This is really hard and I'm struggling." But other times it really isn't. And people put on a really brave face. So I think even though time is always limited in terms of dealing just with the patient, him or herself, but I think it always helps to just ask the caregiver, "How are you doing?" Because this is a really stressful thing. And to kind of normalize that distress for them. But I think in general, what it's good to look out for is if you're seeing your patient to ask, like, how is your caregiver doing? What do you see in them? Are they still engaging socially? Are they still wanting to see their kids, their grandkids? Are they still showing up for meals? Do they still have their hobbies? Are they still doing the things that keep them healthy? Are they exercising like they used to? Are they doing their normal day to day activities? Because I think a lot of times that's where you see the distress come out. It's not so much that someone will come in and say, "I'm really struggling. I'm really sad." It's more that people will just slowly drop out of things. So they won't go to the gym the way that they used to. They will turn down invitations to go out with friends for dinner or to a movie. And I think it's really important for us as providers to reinforce that it's very important for caregivers to keep up those engagements, that normal flow of life wherever they can.
Let me ask you a little bit more about that. Again, I have my own personal experience in going through this with families, but there is a sense for caregivers, I better be home. Something may happen when I'm gone. I better use this time because the time may not be unlimited.
Absolutely. Yeah, I have a person that I see who has a stage 4 lung cancer, has done very well over time, but her husband had a stroke about 5 years ago, and she feels like she can't do anything. She can't go to church the way she used to. She can't go out with friends because she's constantly worried that he's going to have a fall or something's going to happen to him. And in her case, it's really been working through, okay, so how can we get you the supports that you need so that you can engage in those activities that bring meaning to your life. And so we were able to get her hooked up with an agency that could do home health with her insurance. So she now has a caregiver for her husband. And it's really changed her life so that she feels like she can now manage the caregiving that she does for her husband because she has those breaks where she can really focus exclusively on her own health and wellness.
So I want to ask about a topic that doesn't get talked about enough: sex or intimacy. Sex and intimacy are part of a relationships, sometimes more, sometimes less apart. But what happens to that part of a relationship in the midst of a major illness like cancer?
Yeah, sex can definitely suffer for sure. And that can be for a variety of reasons. I mean, obviously, if you're on some sort of hormonal therapy for prostate cancer or breast cancer, that can affect your sex drive and your sexual health. But also, in addition to that, I mean, say in the case of breast cancer, oftentimes partners are really worried that if I touch you, I'm going to hurt you. Like you're fragile right now and you've had surgery, and I don't want to make that uncomfortable for you. And the problem with all of that is that a lot of times couples just don't talk about it. And they certainly often don't talk about it with their providers. So if we don't ask about it, we are not very likely to hear that from our patients that, hey, I want to talk about our sex life that has suffered. So I think it's really incumbent upon us to start that conversation. And again, to kind of normalize that this is something that happens to people that are going through cancer treatment. And let's talk about it and figure out what we can do to assist with that. In a lot of places, there are actual sexual health clinics that focus on cancer in particular and can assist not just with kind of counseling and sex therapy, but can also help with very mechanical instruments to help with a couple's sexual functioning. So there's a lot that can be done. It's just a matter of starting that conversation oftentimes.
So let me actually ask you about that, about starting the conversation. A two-part question. One is how to start the conversation in terms of how couples or partners are doing with each other, with life, with all these stresses. And the second, even more specifically, how to ask the question about intimacy and sex.
I think usually I start the conversation just by asking, how has this diagnosis changed your relationship? Have there been any changes or is it the same? And sometimes that can kind of ease in to actually asking specifically about sex. Sometimes it doesn't. And I'll always ask people when I do ask about their sex life, I'll say up front, you may or may not be comfortable talking about this. And it's fine if you don't want to talk about this, but I'm going to ask the question anyway, even though it may be uncomfortable. Has this changed your sex life at all? And I've definitely had differing responses to asking that question. Some people really do say, I really don't want to talk about it. But I've been very surprised and I guess gratified in my own practice that I think people are a lot more willing to talk about sexual functioning than you would think. One of my first experiences doing support groups 30 years ago when I was in graduate school was going to a prostate cancer support group. And I was amazed that these men in the prostate cancer group talked so openly about sexual functioning and how their treatment had affected their sexual functioning and would swap tips about ways of improving sexual functioning and improving the relationship with partners. And it really stuck with me throughout my career that if you bring this up, most times people are willing to talk about it and are actually very happy that you asked, but it's always uncomfortable.
Thank you. But I have to say, your discussion of it does help normalize it. And I found as well, people are, I think, glad to talk about sexuality, to talk about life, and I think caregivers as well. It's almost a relief when someone stops and says to a caregiver, how are you doing? And again, what impact has this had? There's obviously a huge need for support, both for patients and families and caregivers and care partners. What are some good resources that we can direct people to?
Yeah, well, I know I'm obviously a biased source, but I think LLS has some of the best resources, both online on their website, but they also put on some amazing events that are open to patients and caregivers. I spoke at one maybe 3 months ago that was in Chicago, and the audience was, I would say, almost evenly split between patients and caregivers. And a lot of what we talked about is the impact of leukemia and lymphoma on caregivers and how can caregivers help to support patients through this often very rigorous treatment process. So I would say I would start with LLS, but in terms of general resources, there's actually a lot out there now. And I would say one of the silver linings of COVID is that a lot of the resources that you used to have to attend in person are now available through Zoom and online. So you can access caregiver support groups, patient support groups, yoga classes, cooking classes. There's all kinds of these things that are available through organizations like the Cancer Support Community, through Gilda's Club, wellness wellness house. There are an increasing number of these groups that are across the country that you can access, even if you're in a very rural setting and not in a big city. The other thing for caregivers is there's a Caregiver Action Network, or CAN, and they actually have a host of resources, both online and then support groups that are virtual as well, that caregivers can attend. And the final resource I would say is, I'll hear from people sometimes, I'm not sure a group is for me. And in those cases, I often refer people to a group called Immerman Angels. That's IMERMAN. It's a group that was started in Chicago maybe 15 years ago by a guy named Johnny Immerman, who was diagnosed with a stage 4 testicular cancer in his 20s. And he said when he was diagnosed, he did not know one person who had ever had a cancer experience. No one in his family had ever had cancer. He didn't have grandparents or aunts or uncles. And because of his age, none of his peers had much cancer experience. And so the whole experience just felt completely isolating to him. And so when he got out of treatment, he made it his mission to found this group that's a peer mentorship organization. Started out with just patients just in the Chicago area. Now it's grown so much in the 15 years that they have participants in every single state in the United States, and I think 60 countries outside of the United States. And they've grown so that now not only patients can receive peer mentorship, but caregivers can as well. And the organization is so big at this point and has so many mentees and mentors that they can now honestly match people not just on the type of cancer, the stage of cancer, but they can match people on a lot of demographics too. So if you say, I'm a 40-year-old single mother with 2 kids who's caregiving for my sister, they can usually find somebody that has a pretty similar demographic profile for you to meet with as well. So it's a really good organization, and I would highly recommend people to that as well.
Thank you. Those are great. Tim, you shared that you're a cancer survivor, and I'm interested, how has that affected your life trajectory and also your work?
Yeah, that's a great question. It was obviously a difficult time, but it was a really interesting time in my life because I was already doing this work at the cancer center. And so I was leading a support group at the time, and I knew that I wasn't going to be able to keep my cancer a secret because I was going to have a neck dissection and have stitches, and it wasn't going to be a secret. So I told the group about it. But as a psychologist, we're always told, you keep your personal stuff to yourself. You don't share that with your clients. So I really didn't know how it would go. And it was really fascinating to me, the response of this group. So I went from being the psychologist that led the group and had academic experience in cancer to all of a sudden being someone that could really relate to the group on a different level as well. And so when we would go around the group and kind of have our check-ins, how are you doing? All of a sudden they wanted me to check in and say how I was doing. And so it definitely took some time for me to get comfortable with that. And I will say to this day, I will at times confide in patients my own cancer history, but only if I feel like it's not going to be something where they feel like they need to take care of me. So I definitely won't do it the first visit. I'll wait until I get a little bit of a sense of how they're doing and make sure that they're not going to be a caregiver for me.
Makes sense. Makes sense. Thank you very much. So again, it's Dr. Ken Miller. I have to say this has been a terrific episode. It's such an important topic, not just caring for our patients, but being aware of and caring for their caregivers as well. We've been joined by Dr. Timothy Pearman. Tim, thanks for joining us.
Thank you so much for having me. It's been a pleasure.
Tim is the Director of Supportive Oncology at the Robert H. Lurie Comprehensive Cancer Center and a member of the faculty. So again, a terrific conversation. I want to thank all of you for listening to this incredibly interesting and informative episode, and for a listing of all of our healthcare professional continuing education activities, podcasts, and healthcare professional resources, including a fact sheet on blood cancer survivorship treatment and ongoing patient care. Please visit lls.org/CE. And for any questions or to refer a patient to LLS, please contact our Information Resource Center by calling 800-955-4572. Information specialists provide personalized one-on-one support to help patients learn about their disease, treatment, financial, and support resources that are available in English and Spanish, including survivorship workbooks and caregiver workbooks for adults, children, and adolescents, and young adults. LLS also provides other resources for patients, survivors, and their families, and that can be found at lls.org/support. And finally, I encourage you to sign up to receive notification of future podcast episodes by subscribing at treatingbloodcancers.org. And if you have suggestions for future episodes, please click the feedback button on this episode webpage. We look forward to you joining us on future episodes.
Thanks for listening to Treating Blood Cancers, the LLS podcast series for professionals. We can be found on iTunes and other podcatchers. You can subscribe at www.treatingbloodcancers.org and provide your suggestions for future topics. Visit our archives section on our website for other great podcasts. Be sure to rate and review us on iTunes. Keep up with LLS by following us on Twitter at LLSUSA and on Facebook at the Leukemia and Lymphoma Society, and access our professional continuing education activities by visiting lls.org/CE. Let's keep the conversation going. Until next time.